Hi there. I am Julie Hirschberg from Reactive Physical Therapy and Wellness, and we are a neurologic physical therapy and wellness studio in the LA area. And we really focus on helping people with neurologic disorders regain their lives. And a big part of making an impact that way is helping other healthcare professionals as well be able to help people with neurologic disorders and some of those other rare disorders. And one thing that I was super excited to talk about today was a program that we are launching for people who are newly diagnosed with Parkinson's. So let me give you a little background. We've been partnering with the Parkinsons Foundation for several years now, and they have this great program. So if you're a physical therapist or other healthcare professional, exercise professional working with people with Parkinson's, I highly recommend their community grants. So the Parkinsons Foundation does these community grants to help develop and fund programs for people with Parkinson's. And one of the things that they emphasize this year is that there is a big need for people who are newly diagnosed with Parkinson's disease. And reaching them with resources, with therapy, with education. And so we submitted a proposal and it got funded, and we are kicking it off this month. And I'll give you a little overview of what we're looking at doing and then kind of dive in deeper. But basically what we're doing is we have funding for about 20 people to come in for an initial physical therapy evaluation that's very movement analysis based. And I'll talk about that, and I would love input on that as well, but I'll tell you what we're doing with that. So we have an initial evaluation, and then we have 2 follow-up appointments with physical therapy, one that's sooner and then one that's 6 months down the road. So those are the physical therapy visits. The second thing that we have is personal training. So we have 2 personal training visits with a focus on coaching and starting a sustainable exercise program. We also have a free week of unlimited exercise classes, so people can try different styles and see what might fit for them and for what's fun, what they like to do, what would be sustainable for them. And then within that, something that we're really excited about is we've developed a workbook that is very specific to increasing exercise for prevention for neuroplasticity. And basically this is a goal-setting educational workbook to talk through what exercise is beneficial in Parkinson's, how to do it, and then look at how the individual might do that. So there's some questions and reflections, talk about barriers to exercise, but basically a way to get into some of those lifelong habits of exercise. So that's the program in a nutshell. What is really cool about it is that it is free because of this grant, so free of charge. Now let me tell you a little bit about what the details are of those particular pieces and why they're there and what we're doing. And I'd love for your input on this as well, and maybe what you've seen is helpful or what questions you might have that would be helpful to address if you've been newly diagnosed with Parkinson's. So first of all, the evaluation for this has been something that I've been looking at for about 8 years. So when I first started seeing clients for Reactive, I was sharing a space with Dr. Chris Powers, who is really huge in the physical therapy world, in particular movement analysis and biomechanics and orthopedics. And so as I just had a couple of clients, I spent a lot of time observing and helping him with movement analysis in his practice. And he had some high-speed cameras and things like that. And Betsaida, thank you for commenting. You said there's an error loading. And so hopefully that comes back up. I'm not sure I can do anything about it, but let me know if you're having, if it's able to come back up and you're getting the video going. But thanks for commenting, Besaida, and thanks for joining us. So I spent a lot of time with Chris Powers, and as he was performing these very objective and thorough movement analysis with people who were returning after surgery to get back to sport, my brain was immediately in the world of Parkinson's, other movement disorders, other neurologic disorders. And essentially what I started doing was taking his return to sport evaluation and turning it into a preventative evaluation for people with Parkinson's. And in particular, choosing and looking at common movements where we might pick up something very early on. And so things such as sit to stand, getting up from the floor, turning, walking forward, walking backwards, all of those pieces, and turning into an objective movement analysis of each of those pieces. So not just watching it, not even just biomechanically, but what components are really important and what might we catch something early on so we can prevent movement problems. So that's the big piece of this, is prevention. So we do that with these key movements and look at a rubric so that we can score each of the movements specifically. And then we, of course, want to dive into what are some of the underlying factors. Is there a flexibility issue or a strength issue, balance problems that might be contributing? So certainly doing really thorough testing to analyze that. And one of the tests, actually, our fellow, Claire Cronin, amazing physical therapist, one of the tests that we have developed, and actually there are groups working on this, so we collaborated with Mike Studer and some other colleagues who were also looking at similar versions of this, but it was the 4-square-step test and adding a cognitive component. So essentially, the 4-square-step test, if you didn't know, is a sort of balance and sequencing test. We added a secondary Stroop task to that. So we actually added colored dots that have a different color written on them. And so if you're familiar with the Stroop test, we basically added that to the 4-square-step test. So you could have the 4-square-step test, the Stroop test on its own, and then do them together, and you could look at the dual test cost for that particular activity. And what we had been finding is that you can see some potential impairment in that early on. And again, that's what we're looking at, is early on, where might we pick up a slight problem and be able to really refine and challenge that in order to prevent. So things like that test, the mini best test, the timed up and go, ankle plantar flexion strength has been something that we really see correlated for people. So we have those pieces of the evaluation. We also have some questionnaires. So big areas that we really wanted to look at were balance, so something like the ABC, exercise self-efficacy. So this is what we're really hoping to change with this program, is that people will have the self-efficacy, the empowerment to implement exercise daily in order to have that neuroplasticity. Fatigue is something that we see come up early on as well. Using a Parkinson specific measure like the PDQ-39, looking at anxiety and depression with the hospital anxiety depression scale, and then looking at patient specific function with the PSFS. So we're using, we're really trying to collect a lot of information so we can tailor a really personalized program with this. So we're using those patient report measures, we're using this very thorough evaluation, and from there, designing a very specific program for prevention. And that might look very different for each person, depending on what we find, right? So certainly incorporating key aspects of aerobic exercise, forced use, balance activities if they're if there needed skill-based training. That's kind of the hallmark of what we see from a neuroplasticity standpoint of what is most important, but it's going to be very specific to the person. We have some people who are still running, and so if we do the analysis on their movement and find some little things that might lead to a problem, then we're going to address that and give some suggestions. Some people may need more physical therapy than that, right? So then we would refer them for further individualized therapy and address those issues, but maybe not. So maybe this is enough. And so we'll see after 6 months of what kind of outcomes we have in our program, but I'm super excited to see what's going to happen. So we did a trial run. Actually, I did it just yesterday with somebody, and some of my hypotheses, and I would think many people often would see this, is, you know, we're going to pick up things like a very subtle difference in arm swing, right? And so sure enough, that's exactly what I found. Very subtle difference with the turning 360s and taking maybe short, small steps without a lot of weight shift. And again, this is exactly what we found. And then boom, we can intervene right away and just make simple suggestions on how to potentially change that. So that is the idea, is really being able to change people's lives through simple preventative measures so that the movement problems might never occur, to be honest. And how amazing would that be? So we're launching this program literally next week with our whole team. So we're spending some time standardizing ourselves with the evaluation in the next week. And if you're a physical therapist and have worked with this, with people newly diagnosed, and you found things that have been really helpful, I'd love to hear from you. If you are a person with Parkinson's and you can, maybe you're newly diagnosed. If you are and you're in LA, like, come see us for this free program. But if you also remember, man, I had so many questions about this, or I would have loved to look at my movement in this way, I would love to hear from you as well. Honestly, our evaluation and our workbook and all of this has really come from us working with a lot of people and listening to them. So would love to hear from you. And thank you so much for your inputs. If you didn't know, we do a lot of education as part of our Movement Disorders Fellowship. It's called the Schmidt Movement Disorder Fellowship. And in 2 weeks, we are doing a learning module on camptocormia. So postural disorders in Parkinson's, they can be very difficult to treat. And so July 18th in the evening, it'll be a live webinar online or in person at our clinic, and it will be recorded. So if you can't make it, you can also join us later for that. But we just love sharing this information, helping us all get better in helping people with neurologic disorders. So if you're interested in that, it's available on our website. There's a link at reactivept.com/education. So look forward to hearing from you. Thanks so much, and we will see you next week.